Hello, everybody, and thank you for joining our talk on IASIOS, Experience and Tips and Tricks from a Participating Institution. My name is Maria Warren, and I'm heading the Certification and Accreditation Department at CERSI. I may introduce you to Mardis Karasdottir, the Project Manager of IASIOS. Hello, Mardis.
Hi, nice to be here.
And Professor Laura Crocetti, in her capacity as authorized representative of one of the pioneering hospitals who are currently undergoing accreditation. Hello, Laura.
Good morning. Good morning.
They will share some insights and advice on the process and how to efficiently reach the accreditation goal.
IASIOS is a global accreditation system which offers the opportunity for hospitals to gain recognition for providing high-quality IO services. It also gives them the chance to showcase their achievements, and most importantly, it is an international community of IOs that are working towards the common goal of improving their IO service line, benchmarking, and learning from each other. If you're wondering why you haven't heard about it before, well, that's because we don't officially launch until April this year. The IASIOS program was built upon the CERSI standards of quality assurance in interventional oncology that were published in 2018, and from there a pilot phase began. 12 pilot hospitals from around the world joined IASIOS, including 2 Australian centers as well as Singapore General Hospital. 4 centers have already achieved accredited center status, and another 4 are expected to be accredited before the public launch. The standards of QA are a set of guidelines that safeguard patients and encourage good practice, looking at the whole process of patient care and treatment, split over 13 standards. At the end of each standard is a list of supporting evidence that can be used to demonstrate compliance with the standards. For IASIOS purposes, these are separated into 2 categories: core requirements, which are mandatory to become an IASIOS Accredited Centre, and extended requirements. Without further ado, let's jump into our interview with Professor Laura Crocetti from the University Hospital of Pisa. Dr. Crocetti, you're one of the first centers to participate in IASIOS. Can you tell us a bit about the process, what the first steps are?
Yes, of course. It's a pleasure for me to join our experience. At the very beginning, when we thought about participating to IASIOS process, we went through all the requirements that are actually needed to make the application, and to understand where our facility, our hospital was exactly, how far from the standards that were required. And I have to say that we were quite proud to see that we were near the majority of them, but of course there was still room for improvement, and we would have need to change some of our practices. The other important point that we noticed, and really we did not expect 100%, was how the general management, the administration of the hospital, how much supportive they were with respect to this project. They were really willing to support us, even from an economic point of view, to join the project, to demonstrate that their hospital is able to qualify for European standards. In our case, about interventional oncology, of course.
What would be your top 3 tips to successfully complete the accreditation process?
Start from the beginning. At the moment you have the the stamp, from your administration. Start immediately, build your group, and decide what is doing what exactly. So share the tasks, improve the things you have to improve. At the end of the period, you will collect your result. If I have to give an advice, refer to your quality assurance department, because they are willing and able to help you.
Can you tell us a bit about who is working on your application with you?
The important thing was support of Chief of Interventional Radiology, of course, Dr. Roberto Cioni, but then we set up a team with the Chief Radiographer, Dr. Federica Del Cima, and administrative person, that is Rosa. And then we had the opportunity to have a grant for a new person to join the group, collecting all the material and preparing and organizing. So at the moment we are the 4 of us.
Can you tell us a bit about how the progress on the application was organized?
Yes, of course. We started with a weekly meeting for 2 months to really understand what we had to do and to improve. And then we just take a break where we worked upon all the issues that we raised. And then again started with the weekly appointments. And now we are in the final week. We are all out of our clinical work to put things in to send the application, the final application.
Some people, when they first start thinking about IASIOS, they feel like it's a little bit overwhelming. How difficult is the application?
It is more a matter of understanding what is asked. I mean that as a physician, as an interventional oncologist doing procedures, I may be not very familiar with some terms or with some issues. But then when I looked for them and asked to the right people, mainly from the quality assurance department, I realized that really many of the answers were already there in the building, in the structure of my hospital. So it was just, you know, a little bit of sensation of overwhelming, but just at the beginning. Then day by day, everything became more clear, and we realized that we already had many of the questions, the answers, sorry.
Is there anything that you wish you would have known before starting?
I was really afraid before start, but I felt that for our facility, it was needed to do this step to improve ourselves and to demonstrate that we are part of a system with good standards. I have to say that it was easiest than I imagined because the hospital really had done a lot before. Don't be afraid because we already have many things, just a matter to put all things together to improve at some points, but the majority of hospitals can apply for IASIOS.
Can you tell us what about the IASIOS has benefited your department and the facility the most?
We started to think in a more global way. We started to think if there was here near to me a doctor from UK or from Greece would have done the same thing I'm doing now. Are we responding, applying to the system that is a global one, a well-standardized one? So we're starting to think in a more wide way. I would say this opened our mind a little bit, even when doing procedure and planning.
Thank you for watching. If you want any more information beyond what we have covered here, you can always go to the IASIOS website at iasios.org or be in contact with the IASIOS team, and we will happily answer any additional questions that come up for you.